Welcome to my podcast, The Laura Dowling Experience. Many of you will know me from my Instagram page at Fabulous Pharmacist, where I love to shine a light on topics that people normally shy away from. Today I spoke with Aoife Harvey. She is a chartered women's health physio, and we talked all about the vagina, the good, the bad and the downright ugly. The vagina through the ages is so important that women understand exactly what's going on with themselves. I really think you'll enjoy this podcast. To support the Laura Dowling Experience, please check out our sponsors in the podcast notes below. Enjoy the show. So Aoife, welcome today. Delighted to have you here. We are here to talk about my favourite topic, and I think that's why you and I love each other so much, because your favourite topic is also vaginas.
Indeed it is, Laura.
Tell me all about yours.
Not yet.
Okay. Maybe it's a bit early in the podcast to start talking about yours. But so what is your take on vaginas, being a professional physiotherapist, chartered physiotherapist?
Well, as a women's health physio, all I do in my clinic is look at vaginas all day, every day.
And it doesn't get boring?
No, because no two vaginas are the same. And that is one reason I want to talk about this on the podcast.
Okay.
Because I feel like women hate their vaginas for some reason.
Yeah.
And I feel like women don't know anything about their vaginas, don't look at their vaginas, don't know what a normal anatomy of a vagina is. For some reason, they just don't want to go there. And I think they should. It's really important, not just medically, but emotionally, physically and sexually.
Yeah, I agree. Well, I think it goes back to, and I've spoken about this before, the fact that it's okay for little boys to be playing with their willies. Oh, would you look at Johnny? Isn't he so cute there doing willy copter there while he watches the Teletubbies? Whereas if a little girl has her hands down her pants, it's like, take your hands out of your pants. You shouldn't be feeling yourself. It goes down to that whole shame thing in the female anatomy, and it's instilled in us from a very young age. So I'm not surprised that women don't know what their vaginas look like or their vulvas look like. You know, if there was a lineup of vulvas, would they be able to pick their one out in a crowd? I doubt it.
In fact, I don't think they'd be able to pick any out in a crowd.
Okay.
I don't even know if they know what a vulva is.
Okay, so let's break it down and talk about what you see in your clinic and the problems that you see, and the questions that you get, and then how we can, as women, be better informed about our bodies, because it's such an important part of our lives, and it changes with age.
Yeah, well, the first thing I would dare any listener to do is go and get a mirror and look at their vagina at some stage today when they're listening to this podcast, and get familiar with it, because there are some changes that can happen that, you know, like there is such a thing as vulvar cancer that women should be looking out for. But not needless to say, when you have babies, how much it changes. And we always, on both our Instagram accounts, get messages about this, like throwing a sausage up O'Connell Street type thing. But how can women know what's normal if they didn't know what it was like before they had babies? Or they don't know what are the realms of normal, or how much it will change. And you know, if their experience of their vagina, let's say having sex after babies, changes, or there's a prolapse, how are they supposed to know if they don't know what it looked like when it was actually healthy and young and vibrant? But you know what? When it is young and vibrant, women have other issues with it. Not only are they still kind of shy, I really think there's this hate for their own vaginas. I think when they're going to meet men and have sex, they're kind of shy, and you know, they want the lights off, and it mightn't be because they don't like their tummy or their boobs. It might be because they're shy about their vagina or the look of it. Like some women's labia hang out, you know, like an outie of a belly button. Some hang out, and women can be really embarrassed about that, but they don't realise how common it is. And I don't have stats, but it is quite common. And I think
or one can be longer than the other.
Yeah.
There is an Instagram page called, what is it called? The Vulval Anatomy or something. And it has all different pictures of vaginas, vulvas, both pictures drawn and also, I don't think they're actual pictures. I don't think they're actual.
No, they're more artistic.
Yeah. But it is interesting. And I remember at one stage on Sex and the City, didn't Charlotte have a depressed vagina? Yeah. She was told to take, was it Prozac for her vagina? Yeah. She never looked at her vagina.
No. And that was actually, I saw that on recently. I took a screenshot of it and I was like, you know, that was such a good programme for opening up these topics. In fairness, it was. Even if Carrie was a bit of a bitch. But, you know, yeah, women, when they're having sex when they're younger, sometimes they can experience a lot of pain during sex. And when Charlotte's vagina was depressed, because there's this huge connection between your brain. So if you can't relax when you're having sex and actually be feeling what you're feeling, how are you supposed to enjoy it? Because so many women are just shy about it, or there's pain. Vaginismus is a really common symptom we treat in my clinic, and not just women in their 20s, but in their 30s, 40s, 50s. I have met, Laura, women who've gotten married, who've never had sex before, who want to start a family but cannot tolerate sex, and they have to go down the IVF route because the clock is ticking and they don't have time to reach a point with their partner where they can have sex. And women think this is so uncommon because it's not talked about. So whatever about leaking now and prolapse are starting to talk about, they don't talk about pain during sex, and they think they're the only one in the universe, and it can take them years to find me, and that's really frustrating.
So vaginismus I have spoken about on the podcast before, but it is more of a psychological issue, is it, than an actual physical? Is it a physical issue that manifests initially psychologically? Is that it, or how?
So our pelvic nerves are actually connected to our frontal cortex and our brain. So that's your fight or flight response. So they're intertwined, right? So when someone feels scared or anxious, they're going to go into fight or flight. And as a result, their muscles actually go into a spasm. So it's a physical spasm in response to the nerve. It's a bit like someone's, bursting out to the loo when they're nervous and they're about to go into an interview. Is it in their mind, or is it that their nerves are panicking and it gives them this urge to wee? So similarly with vaginismus, it's not like, women then think, it's in my head, it's in my head. If you're in a situation where you're actually feeling scared or afraid, or you're anticipating pain, is it not normal for your brain to go into fight or flight? I think it is.
Yeah, and then the whole anticipating pain thing, is that to do with the fact that we're taught that sex is going to be painful, and that might be that reason. It doesn't necessarily mean that someone has to have had a trauma in their lives, and
absolutely. They could have had a trauma, or they could just have lack of experience. So sex can be painful for the first time, Now you can be fortunate enough to have someone with a small willy on the first occasion that breaks you in. But some women, it does hurt. It changes the hymen. So the hymen is the bottom of your vagina. So if you've never had sex before, I don't like to say the hymen needs to be snapped, but it does affect that hymen, and it needs to open. But is it not
snapped when people ride horses, or when they, use tampons and things like that? Isn't that the whole thing about keeping, in some cultures, the hymen is a very important part of the virginity and the proof that someone is a virgin. But, if someone's been doing gymnastics, it can snap too.
Yeah. But look, even tampons, so you'll find women with vaginismus don't use tampons.
Okay.
So it's like nothing has ever been near their vagina.
Okay.
And yes, there could have been a trauma. I'd even have women that have just gone to see a gynae and have never had sex before and had a speculum exam and are traumatized from it. But when you force something into the opening, so it's like the opening just shuts closed, right? And it's like the door won't open and something's trying to jam in, being it a penis or something else, and it just won't open. And so their body goes into this spasm down there. But if their brain can't relax, then the nerves won't relax, and then the muscles won't relax. So when they come to see me in clinic, I'm trying to teach them how to relax those muscles and how to relax their brain. So it might be pelvic meditations. There's some great meditations out there, but sometimes it's just them getting used to their body, even using a mirror to look at it, getting a vibrator out. Dilators is a big thing we recommend, and their silicone is the best kind of material, but they come in a box with all different sizes, and women kind of slide them into the vagina. And as they kind of feel they can relax more, go up a size and up a size and up a size.
Okay.
Now, they can be really good, Laura, but what I find is sometimes they work great, but then when they're in the room with the man, they seize up again. So even when they're in clinic with me and they really get to know me and trust me, we can make really good progress. But then when they go back to the partner, or if they don't have a partner and it's a one-night stand, their brain panics again and it just all closes up.
How common is vaginismus? Because up until recently, I probably wouldn't have known very much about it other than it existed.
We don't have stats because it's really unreported. So even if people report it to their GPs, we don't write it down. And then they really are, it's a really embarrassing topic. How many women do I see in clinic? Out of 20 or 30 a week, I'd see at least 4 to 5 with vaginismus. But obviously they're coming to me, and the really frustrating thing is how long they take to find me. So they're often sent just for counselling, or sometimes someone will say, just have a drink of wine and relax, and that's really frustrating.
Yeah.
Because it's way more complicated than that.
Okay. So do you do a lot of you do internal examinations all day long?
All day long. So with vaginismus, I'd be using just a finger, but and obviously with the glove on and a bit of lubricant, but we're trying to get more than a finger in and just actually help them to let go as I'm doing it. So for some, that could take a session or two for them just to trust me to do it.
And when you're saying about someone that they may be going through fertility treatment because they can't actually physically get pregnant, how do they physically get the baby out then as well? Does it just happen spontaneously then? Because
it's in labour?
Yes. It do, the baby, it's not as if their vagina is so closed that it will affect the delivery of the baby, is it?
No, but what a lot of women with vaginismus might do is actually have an epidural. They might be actually encouraged to have an epidural because if their body's more relaxed, they can feel it. Now, a baby will break through a tight perineum, don't worry, and they will probably never experience vaginismus again.
Okay.
The complete opposite. So in my clinic, it's quite funny because you've the women who are too tight to allow a penis in, and then you've the women wondering, is there a penis in there?
And let's get on to that, because that's actually a huge topic, and that's, and I think that's where you and I began to start talking together because of those confession boxes that I have, which is the reason why I'm doing the podcast in the first place, because all of those confession boxes brought up so many issues that you just can't discuss on an Instagram live in depth, and you can't discuss it. And I just found that this is the best way to talk, and if someone's interested in a topic, they'll listen to it. So when people are having sex, or they're worried about the fact that their vagina is too big. Isn't it funny though? Men never worry about the fact that their penis is too small. Well, maybe they do privately, but what I mean is that, it always seems to be the women that are like, oh, I don't know if my husband can feel me or can enjoy himself, or I'm certainly feeling a little bit different during sex. The vagina does change after you've had a baby, yeah?
Absolutely. Always.
But not after cesarean. It's only if the baby's been pushed through the vagina. Okay,
yeah. It's only vaginal deliveries.
But I feel that when we have conversations like this, it's almost putting people off natural deliveries as well, which is unfortunate. But I think it does really need to be spoken about too, because it's part of life. Because I know that when we talk about cesarean section rates and the fact that there would be ob-gyn registrars, females that would opt for them themselves, having seen what I suppose deliveries do to a woman's body, but obviously they're also highly tuned into the things that can go wrong as well, and a lot of them would opt for cesarean sections. I feel that's because I had lovely natural deliveries myself, and they were wonderful for me, and I feel lucky that I had them. But I'd hate to put women off that, but I suppose we need to talk about it too,
and hopefully we're talking more to women who've already had the baby, so they need to hear this rather than if you're pregnant now, maybe switch off and come back on to us after the baby's been born.
In about 10 minutes time. But so talk me through what happens, the vagina.
Well, look, obviously as a baby comes through the birth canal, it stretches things. Now, what people need to know about their vagina, and they really don't get this, an analogy I like to use, do you know Charlie and the Chocolate Factory? You know when they're going through the little door into the Oompa Loompa place?
Yes.
You know where Augustus Gloop falls in the chocolate river, right? The vagina is a bit like that. A tiny little door, right, to be the entrance. But inside, it's quite wide and it's quite open. So look, we'll talk about pessaries later.
So it's thin on the, not thin, it's narrower on the outside than on the inside.
Yeah, as you get in, the space opens, right? So what men really...
It's funny how a man would never tell you that, isn't it? Like,
did you even know that, Laura? I bet you didn't. Because when I show women things like a pessary, they're like, oh my God, that can't go in my vagina. And I'm like, do you realise what
size your vagina is?
And also the vagina in itself, you think it's this straight tube, right? This tunnel that just goes straight up into your body. It doesn't. No. It's like a little hill, right? When you go in, where the rectum is, it's like you go in and over a little hill, and the gates go out to the side. So there's this tight entrance door, but once you go in, there's twists and turns.
Once you're in. There's twists and turns. Lovely.
So, and look, that's important for even when women are struggling with the angles of sex. Like women will say to me, his willy's hitting off something. And I'm like, yeah, that's your urethra. Okay. Because where your wee comes out, I really need to say this for women. There is 3 holes, right? Back passage, vagina in the middle, and the urethra where your wee comes out on the top. And they're all beside each other, and it's a really bad design. Like, it's a really bad design when a head comes out the middle and you're talking about an 8 centimetre, 9 centimetre, 10 centimetre head, things are going to be stretched. They just are. And how much it recoils is really based on your genetics. of course, like size of the baby, like we're all about stitches, Laura, like how many stitches did you get? What kind of tear did you have? But your fascia, or how elastic you are is based on your genes. And that's why your tummy's so lovely and mine isn't, because your genes. So there's not much.
It's definitely down to, so much of that is down to genes.
Yeah, and there's people, like perineal massage is important to help reduce tears, don't get me wrong. But how much a woman's vagina stretches and recoils is really due to her genetics. So after women have babies, like the vagina becomes more open. So that opening door like gets burst through, and then it becomes like a sliding door. Exactly. French doors instead of a single unit.
It becomes like a big gate that everyone can go through.
So look, if you're still with the same penis and the penis is the same size, but the door is wider, it's going to feel different.
Okay.
So, when women come into me postnatally, they really don't see anyone else postnatally. No one checks their vagina, and that is true. They check their stitches sometimes, but they don't really check their vagina. So I will measure women, every single woman that comes into me, and make a record of it. Like, how wide is their genital hiatus, which is the opening? How wide is it? How long is it kind of perpendicularly?
Do you go in there with a ruler or your fingers?
So there is a ruler called a pop-Q stick, but they're really expensive. Physios get really good at eyeballing. Like, when you start using a pop-Q stick, I go in with my 2 fingers and I'm like, that's 4 centimetres.
Okay.
Like, that's 1, that's 2. What's the difference between them?
Okay.
So, and then I'll measure them the other way, and obviously looking for prolapse and things. So women will be wider, but there's different variabilities of how wide that is. So when women feel like they're having sex for the first time, they're always afraid it's going to be sore, and it can be because of tears, but it also can feel like not as, they don't feel the same sensation, or they don't feel the same tightness.
This is post-birth sex.
Post-birth sex.
Oh yeah, okay. The sensation definitely changes initially, certainly, until everything kind of gets back to normal, which can take a while. It can take up to a year, or maybe never, yeah. We
actually find in evidence whatever's back to normal by 6 weeks is usually what it stays at. So,
as in sensation-wise?
Not sensation-wise, in terms of the physical change.
Okay.
So how much, like let's say there's a prolapse at the beginning, or how much closure there is, So nerves can keep regeneration in terms of sensation, but in terms of it being wider or stretched, whatever you get to at 6 weeks is kind of what it stays like forever.
And when they talk about you can go in and do, that term, the husband stitch.
Yeah.
Right. So is that only tightening the outside?
Yeah.
So it's still, and can you just explain what the husband stitch is for our listeners, please? Because
so
it's a horrible misogynistic term.
And I think it was used more years ago. Oh, this last one's for your husband, especially with episiotomies. But it's basically that they're doing extra stitches around the entrance point to make the entrance tighter, so that when the man's penis is going in and out, that's where he's feeling that compression, is at that entrance point. So if they tighten it a little bit more.
Is that a revelation there? Is that why they go... Is that why they go in and out? Because the entrance is narrower than the inside, so they go in and out, and the compression is happening when they're going in and out.
Yeah.
That is actually a revelation to me.
And
and that's why they just don't go in and stay in and ejaculate staying in. It's more they come in and out, and it's that feeling. Okay?
Absolutely.
It is a fantastic design, the vagina. Like, I know it's got its issues, because obviously it's not a really good design all over because of all the problems that can happen.
Yeah.
But in terms of pleasure for the penis, it's a fantastic design.
Until babies come. So it's maybe not a good design, because the penis gets you pregnant, then it fucks it all up.
Yeah. Okay, fair enough. Yeah, fair enough.
No, I'm joking. Not for everyone,
yes,
okay? It's for the people who it is, they do feel like that. So sensation changes because the tissue inside stretches. So if women have prolapse or the nerves are stretched, they just don't feel the same sensation. So for women, it's that the inside of their vagina feels numb now. Does that make sense? So
no, it does.
So then they're not feeling this lovely penis inside them doing anything to them and stimulating them. And then the man's maybe not feeling that same closure on the outside.
Okay.
Now, just a little tip for women, if you really want to please your man a little bit more, like if you're nervous about this, you could squeeze your pelvic floor while you're having sex.
Yeah.
If you squeeze your pelvic floor there at the entrance of the vagina, and if you squeeze them really tight, he will feel that compression. Rather than just doing your pelvic floor exercises, but actually while you're having sex.
Okay.
And another nice little position I don't know, I'm not a sex educator, so I don't know all the fancy terms. If you lie on your stomach, like flat down on the ground or on the bed, and he lies on top of you and puts his penis in that way, you can kind of squeeze your thighs together. So you get this kind of more forced closure of the vagina, and he will feel like that's more satisfying to him.
Or you can always just put your fingers around it.
Yeah.
Down there as well.
Could.
And just squeeze tightly too.
Yeah.
You know, there's plenty of ways that you can do it. But I really want this to be about, like, I know that this is about, like, oh, if you want to please your man. But like, really what this is about is we want to educate women on how they can get back their vagina to please themselves too. Isn't that right? And to enjoy sex themselves and enjoy their bodies as well. So, and that's why people would go to see you. But my issue with them having to go to see someone like you and having to, like you said, find you, is that it isn't forever. You know, like we aren't told about this. All we're told about is you have your baby, you're packed off, there you go, do your pelvic floor. That's all you're told. You're not told how to do them. Whereas in the likes of France, they follow up for 6 months if they need to with physio. You know, I know a friend of mine, she said she was living in France, she had her first baby, and literally the physio came and did an internal, and, you know, oh yes, we'll get you back again, we'll do your, you know, and that's normal over there. Like, they take it very seriously, vaginal health, pelvic floor health, far more than we do.
And look, in Ireland, I think pregnancy care is deadly. I went public on both mine.
Yeah, so did I.
No issues. I think compared to the other public sector, I think maternity hospitals do brilliant.
Yeah.
But you get about at least 12 appointments while you're pregnant, right? I feel like your hand is held. There's so much information out there, nearly too much information. You have your baby and you're just on your own.
Yeah, it's like falling off a cliff then, isn't it?
And even though you're totally freaked about like trying to breastfeed and especially on your first, you're like, oh my God, how do we keep the baby alive? And they won't sleep and I'm exhausted. But the changes that have happened in your body are like this. It's not just about vaginas, hair falling out, postnatal depression,
hating your partner.
Yeah.
Just to let you know, guys, it's okay to hate your partner after you've had a baby, and it's okay to hate them for months and months. Even if they breathe beside you, it's okay to be really irritated by that too. And I've said that to so many women in the pharmacy as well. You know, they come in with their newborn. I said, just by the way, it's okay if you hate your husband. They're like, oh, you're the first person that said that to me, you know, because this whole thing about, you know, you have to go home and be a little family unit and that, it's a strain on the marriage and it's a strain on the woman.
And like, even things we always joke about, like the photos you get, like all my postpartum photos, I'm in my pajamas and a dressing gown, like literally look like hell, haven't slept. And then he has all these pictures with the kids where he's like lovely and showered and looking fresh and hasn't just been pregnant.
That's the thing though, isn't it? There's loads, I saw something recently where the woman was showing all the pictures of her babies growing up, and it was like she had taken all the pictures and it was of her husband and the kids, and there was none of her. Yeah. So I think it's more like, take the pictures of yourselves, girls, and in actual fact you'll look back in those pictures where you were in your dressing gown looking like crap, and actually you'll be like, oh, I looked a lot younger then than I do now, so I actually look a lot.
And maybe even skinnier.
I look brilliant. You know, you look back in them with fondness, because I only have a couple of them really, because, you know, the whole smartphone thing wasn't around when I had mine. So I only have those few precious ones. But I think nowadays, if you do have your smartphone, take loads of selfies.
Yeah, but you just wouldn't want to frame them around the house. And don't give out to me for saying that. I wouldn't want to frame them around the house. I'm like, oh, I hate myself in that photo. I look like death.
They're for yourself. They're for yourself in your little albums. But getting back to the issue that we were talking about and the postpartum, because that's a serious area of interest with you. Yeah. And you don't think that there's enough done for postpartum women. So let's discuss.
Probably because my age profile, I've just had a baby last year, and it's who I see in clinic a lot, as well as other, obviously, problems down there like incontinence and prolapse. But it's a huge gap in health. Like, most women get one postnatal checkup either with their consultant or with their GP, and in the vast majority of them don't even get their stitches checked or their vagina checked. So now women are referring themselves to me privately, and unfortunately they have to pay. There are physios in the hospitals, and Laura, it's not their fault. We're not trying to bag out the hospitals. They just don't have the service. Like, they're looking after women who've had, like, you know, ovarian cancer and all these different surgeries, or women who've had really significant tears. So it's no one's fault, but there's just no service for it. So women have to come privately to someone like me and hopefully get money back through their health insurance. But like, even to just come once off and get a check, and we look at things like their posture, their backs, their spine, diastasis, which is the gap they get in their tummy muscles. We want to make sure that has closed by about 8 weeks postpartum. For some women, it doesn't close and no one tells them, and they get really bad back pain from it. And
what's the options for women like that? Is it just exercises or
rehab if it's not too bad? But if it's like a 6 or 8 finger gap, surgery. And
Okay.
I don't even think that'll be covered publicly. Women have to go and kind of get tummy tuck type surgery, like 10 grand you're looking at for aesthetics.
Okay.
So, but it's only in severe cases, which is very small numbers.
Okay.
But it's just that it's not checked. So women can have coming into me after their third baby with a diastasis and they just don't know if they've had it for years before. So we can rehab them with exercises, with breath, with rib engagement. There's different things to look at. It's not just going and doing your sit-ups. We always used to say sit-ups were bad for it. They're not bad for it, but there's a bit more like to do with how you manage the breath in your tummy. Diastasis will be more of a genetic thing again, rather than, I had 3 babies close together, but C-sections are a higher risk. But when it comes to the vagina, like I'm assessing women and 50% of women have prolapse after they have a baby. But everyone thinks it's an old person's problem. And they just think like, oh my God, I'm a prolapse. It's like a postmenopausal, someone in their 70s. By the way, women coming in their 70s with prolapses are just as freaked out. We think we'll be okay about things when we're older. We are not.
No,
you
I know, exactly. And it's like you feel your body's failing you as well.
Yeah.
Is there problems though with women going back to the gym too soon after having a baby here? Because like, it's like, let's get my snap back body. I'm so strong. And they're lifting weights. And even I know now, so I'm 42, that I shouldn't be lifting like weights that are too, certainly unless someone is looking at me doing them. Because you can pop it out. And actually, it was so funny there. About a couple of years ago, I had this young lad give me a gym program up in the gym. And he goes, so I'm going to get you lifting weights. I said, okay, I don't want to prolapse, okay? And he's like, and he looked at me. I said, you know what that is? I said, I don't want my vagina hanging out of me, right? And he shot this poor fucking 19-year-old, But but it is true. Like you've women that are going and getting programs, and they're getting programs that are lifting too heavy a weight. And as a result, they are, if they're not giving themselves a prolapse by lifting that weight, they are going to make a prolapse that they currently have much worse. Isn't that right?
Yeah. Look, it's a fine balance because I lift weights and I don't want women to be afraid to lift. So sometimes if they were thinking of prolapse surgery, this consultants will say, don't lift weights ever again.
Yeah.
And I'm like, how do you lift your life without moving a couch? Or, bringing in heavy shopping bags.
Yeah.
Like it's not reasonable to say don't lift anything heavy. But when you're lifting weights, it's about how you do it. And the breath is key. And again, not going mental on the weights if you can. I think as we get older, like I don't work with a personal trainer anymore. I want to go to the gym and actually enjoy it. Like I want to stick on my Jay-Z. I'm all about my hip hop when I'm because I like to feel manly afterwards. I don't know. It's like something about lifting weights. Like there's the testosterone.
Oh, really? Okay.
So
yeah.
Each to their own. But it really does boost your mood and your testosterone as females lifting weights. And weightlifting is great for osteoporosis and menopause. So I think we should all be lifting weights, but it's just not going mental. And it's the kind of jumping around or lifting to the point of fatigue. Those max rep efforts. If women, and I'm going to make a noise now, if you lift a weight and kind of hold in your breath and ear down like that, it's like having a poo. It's like really pushing out poos that you're constipated. That puts this huge pressure down on your pelvis. So let's say you had a baby and you had a small prolapse and you didn't know, Laura, but then you had a few strings of fascia just hanging on by a thread. And then you lift this weight.
A few strings of fascia just hanging on by a thread means.
So like when it comes to leakage, when it comes to prolapse, it's not about pelvic floor. Okay, I know everyone's in love with the pelvic floor. I just want to tell you, it's not about the pelvic floor. I always say to my patients, right, think of if someone did their cruciate ligament. Okay, if you went to see a physio, a cruciate ligament's in your knee, and let's say someone's running or playing football and they damage their cruciate. A physio cannot repair cruciate ligament, right? Ligaments connect bones to bones. So in our pelvis, a ligament will connect your uterus to your back, your spine, the lower part of your spine. After you've had a baby, those ligaments get pulled and stretched during the pregnancy and during the delivery. And sometimes they snap, or they stretch so much that they don't recoil back. Okay. And that recoilability is to do with your genetics. Okay. So they get pulled. And of course, the older we get, and we're all getting older, having babies, our collagen's not as good. So they're not tightening back up afterwards. So if you've had a few ligaments or fascial connections that have stretched, and then you go and do something that puts a lot of pressure on your body, then those last little bits that were hanging on could stretch that bit more or snap. So some women, not every woman, but some women with prolapse will feel the moment that they felt a pop. And it could have been, I was lifting my toddler, or I was in the gym doing something, or I was jumping over boxes, whatever it may be. They'll feel this pop where something goes. Not everyone feels that.
Oh God.
But as you're getting older, and we think of this as an older woman's problem, you could have like a grade 2 prolapse after you've had babies. You never feel it. You just don't know it's there unless you come to me and I tell you. And then they look at me like I've wrecked their life. They're
I feel I want to come to you just to see.
Well, if you put it on camera, no, I'm joking.
Insta Live prolapse. What can we call it? Insta Live prolapse finder. Gosh, no. Don't worry, I won't subject anyone to that.
In some ways, I'm like, I don't, like when I see a prolapse, I don't want to tell the woman, but I want to tell her. But I'm like, if I tell her, she's going to like psychologically be walking around going, oh my God, I have a prolapse. Or when she's having sex, think, is he feeling this? Which he isn't, by the way, because they're very soft. So when a woman is lying down, the two parts of the vagina walls are coming together. So the man does not feel a prolapse at all. But I suppose it's just...
If she's lying down, what if she's rodeo
in
cowboy,
any position, he doesn't feel it.
Okay.
I promise, okay? So don't be freaked out about your prolapse. But I think it just gets into women's head that my vagina's broken. You know, like I broke my vagina, everything's hanging out. Oh my God, I have an old woman vagina and I'm only in my 30s.
But it's better if they know it, because then they can do exercises to help, isn't that right?
Yeah.
Or not? Does it matter if they know or not?
It doesn't matter if they know or not, if they're asymptomatic, Laura. So if they don't have leakage or they don't have constipation, like if they don't know and it just stays being this low level prolapse and doesn't affect their life, it's fine for them not to know till they're 40, 50, 60, 70, you know?
Okay.
So we don't treat prolapse unless they're asymptomatic. However, if someone came into me with leakage and I see they have a prolapse, I'm like, that's causing your leakage.
Okay.
So when they do come in, I do tell them though, the reason I tell them is, let's say they're going for the next smear or they have another baby and it gets worse and no one told them. So I think it's better that I tell them because I can explain it really well to them, and I try and explain it in the least fear-mongering way that I can. Now I'll always get an email later going, can I just ask you loads of questions?
Yeah, okay.
But like, let's say they go for a smear and someone's like, oh yeah, you have a bit of a prolapse there, shoot with the speculum, you know? And they're like, what? You know, so I'm quite good at explaining things in a non-medical way, in a way that I hope comes across well. And I want them to know what's going on in their body. But I just feel like I'm breaking their heart when I tell them. Unless they come in going, I have this heaviness, I think I have a prolapse. I've been following you on Instagram, so I know what a prolapse is.
Yeah.
But when they don't and I tell them, I can see in their eyes like I've just wrecked their life.
Maybe I won't come to you, so.
I think it's better not to know.
Okay.
But again, if it affects their constipation, like if it's affecting things, they need to know, because managing their prolapse is going to help their other symptoms.
Okay.
And it's not just all about pelvic floor exercises.
Okay, so what is it about?
Prolapse pessary is my favourite thing in the world. And I've heard doctors talking on podcasts and other places about surgery for prolapse, right? And it is an option and loads of women do it, but the failure rates are quite high.
What is quite high to you?
Well, with the anterior wall, so with a bladder prolapse, the failure rate's 40%.
That's huge.
That's huge.
Within how many years? 5?
Look, a failure rate is just that it needs to be done again rather than in years. It could depend on their age, Laura. So if you have it done younger, it might last longer, if that makes sense. We won't go into the whole mesh saga, but if you're using someone's fascia to repair themselves and they already have bad fascia, you're using something that's already weakened to hold something up, you know? So when it comes to prolapse, my favourite treatment is pessaries, and they are little silicone devices you push inside your body. And we
ordered them into the pharmacy.
Yeah, so there's the big scary PVC ones, which I'm not such a fan of.
They are massive.
Yeah. So I had a pharmacist in recently with me, actually, and she had a prolapse. And when I talked about pessary, she was like totally freaked because they ordered them into the pharmacy, right? God.
And literally, like, you'll see now if you're watching on the video, I'm doing like a big size. They do come in looking big. They look like a bit, like almost like, you know, you're whatever, 6 centimetres dilated or something with them. Yeah.
So when I show women even this, so I have a small one to show women in the clinic, so don't freak them out. But when I show them the small one, they're like, what the fuck? That's going in my vagina. Okay. And this is where I get to Willy Wonka's chocolate factory, right? That your vagina is that big inside. So they look at this, I'm like, what size is your baby's head? You know, because they're totally freaked.
Okay.
So,
and this comes back to the whole thing, thinking your vagina is like, you know, tiny on the outside and not realising it's like a big cavern.
Yeah. So, like, it doesn't stay the size of your baby's head, right?
No.
As in the cervix dilation, right? But when it comes to this pessary, and the ring is the most popular one, when we're putting it in, we squash it in. So we have to get it through the opening of the tunnel. But once it gets inside, it just pops out. And when it's in there, women don't feel it. So this is my favourite analogy for it, right? I wear contact lenses, okay? I didn't get laser eye. I have poor eyesight. I wore glasses, then I started wearing contact lenses. I do not walk around my life going, but when I take my contacts out, I still can't see. Okay? It's a mindset, isn't it?
Yes.
If you put in a pessary and you cannot feel it and it lifts up your prolapse, that's the answer to your prolapse.
And you have to, so you don't have to take it in and out all the time, do you? Once it's in, it's in?
Once it's in. With the PVC ones, you have to go back to the GP every 6 months and change it, right? With the silicone ones that I use, we tell women to take them out just once a month and give them a clean. That's when they go, oh my God, I have to touch my vagina. I'm not putting anything in my vagina. And I'm like, what is wrong with you? Touch your vagina.
Touch it. Get used to it. Understand it.
And I'm like, when we squash it up, it's like the size of a tampon. And I was like, oh, I don't even like tampons, you know?
Okay.
So they're just so afraid of their vaginas, and it only gets worse as they get older. Like,
can I ask you about sex then during it? So, excuse me. I know that you can have sex with it, but like, does it not, like if there's ejaculate there, does it not like hang around for a bit longer? And
no,
if the ring is there without it coming out?
So one of the only pessaries you can have sex with is the ring, by the way. There's a lot of the other ones you have to take out to have sex, okay? But if I had to take my contact lenses out to have sex, I'd do it, okay? So let's just still keep it simple. You take it out in 2 seconds, you know? Remember even Sex and the City when her diaphragm stuck? Like they used to put in diaphragms to have sex, you know?
Okay.
And the menstrual cup, so some of them you do have to take out, but they're still fucking great because they support prolapses. But with the ring, it's a circle, so the penis just goes through it. The man does not feel it. So I'll often say,
the penis goes through the ring, or does
the ring sits up at the top, so it depends how long his dick is.
Okay, so I didn't realise that. I just thought it sat at the top of the vagina and held everything up, and the penis would hit off it rather than go through it.
No, it circulates the cervix.
Okay. So
have you ever felt a penis touching your cervix?
Yeah.
I always say that to women, like while they're listening, cervix is drop in position close to the menstrual cycle, and you can get an old bang in the cervix if you're the week before your cycle because it's lower and harder. But the ring sits up at the cervix.
I am learning. I thought I knew all about the vagina, but honestly, I'm actually in awe of many of the things you said today.
There's a little shelf, right? So you have this little tunnel as you go in, and then there's this shelf where everything opens up. Okay, that's the levator hiatus. When you've babies, the shelf can get a bit wider, right? Okay, so the tunnel does exist for
anyone listening on audio. Aoife has about like 4 feet between each hand there when she's suggesting how wide the vagina can get. I don't think she's as good at geometry as she was suggesting earlier. I think you do need that ruler. So go on, sorry, I stopped you.
No, joking. Look, after babies, the levator hiatus. So the tunnel does get wider after babies, but up we have this shelf at the top where our cervix is, and that's where the ring sits. So that's why in pharmacy you would have seen bigger rings, because women will have bigger shelves up the top, and some don't have a shelf at all after baby, so we can't get the ring up there. And this is the truth of how much vaginas are changing. We're all about this opening. Is my vagina wider? But there's so much happening up above, be it the prolapse, be it I don't feel anything because my nerves have been so stretched, or be it that the levator hiatus, that shelf has opened up so much. So when we put a ring in, it sits at the levator hiatus, but at an angle. So actually, when you're taking the ring out, it's right there. So women feel like, how am I supposed to reach my hand up? And it's because they don't understand the anatomy of the vagina. I'm like, you're not reaching your hand anywhere. The ring is just there.
Okay.
So you literally hook your finger under it and whip it out in a second. Okay. So I teach women how to do that. Like you're saying about sperm, Laura, in young women, they might want to take it out once a month after they've had their period, give it a clean. They might want to take it out when they've had sex, but the silicone does not breed any kind of infection. It's not dangerous, but your vagina has a microbiome. So your vagina gets infected. So if you have thrush, if you have bacterial vaginosis, if you have a UTI, you want to take out that pessary. So we want women to self-manage it. Look after it themselves. Give them a sheet to go home with. If this is happening, take it out, give your body a rest, treat your infection. It's nothing to do with the pessary. But the only risk to pessaries is the neglect of pessary. And that is women in their 70s that get a pessary, forget it's in there. Everyone forgets it's in there. It's in there for 10, 15, 20 years. And their body grows around it. So it literally grows into their vaginal tissues, because with aging, the vagina tissue gets so thin that it will actually grow around it. So it's stuck in their body, and that's the only risk factor. But that is the older woman who, let's say, gets dementia, goes into a home and everyone forgot this pessary was in her. And that has happened.
And does that cause issues or not?
Yeah, well, it can cause issues and it can cause pain, and they might have to surgically remove it, or they can't remove it anymore, that it's grown into their body. But that has way less risk than the actual surgery of prolapse, you know?
Okay.
So that is the neglected pessary or erosion, which is why women need vaginal estrogen to stop that happening, is so much more low risk than having a surgery. So we should be pushing pessaries to everyone, you know.
And people need to be feeling their vaginas and knowing exactly. No one go in there, feel the little hill, feel that hill.
If the hill's still there.
If the hill's still there. And then feel the cavern behind it.
Feel the cavern. And then don't be afraid, like put your fingers and take them out. Look at it with a mirror. Like I said, there is such thing as vulvar cancer. You know, when we're talking about checking our breasts, down there women should be looking for darkened lumps, white lumps, red lumps, seeing if there's changes to their vulva. What are your vulva, I hear you saying?
Yes, go on. Please do explain.
So your vulva are your labia, which are the flaps, the big flaps, the inside flaps. Also, you know, just around where your clitoris is, your urethra. So everything that's external is called your vulva.
So your clitoris is external?
Yeah. That's your vulva. And then your vagina is just the tunnel. So when we talk about female genitals, we always talk about the vagina. That's only the tunnel.
The tunnel.
Yeah.
Okay. The tunnel of love.
Yeah. And I know you've talked about this before. Loads of women never orgasm through the vagina anyway. So when you're saying about women having sex, it's all about the clitoris. So if your vagina is letting you down, focus on your clitoris. It's where most women
will have clitoris. Yeah, absolutely. And, you know, in learning about your vagina, you'll learn about self-pleasure and what you like. And you might have that orgasm that you've never had before, you know, and I think that that's so important that women do explore themselves.
Did you talk on your sex talk about the squirting after?
So I talked about the squirting because squirting seems to be this thing nowadays that's, you know, everyone wants to do. And if you're not doing it, you know, or if a guy has been with a girl and she's squirted before and then he's with a new girl and she's not squirting, he doesn't think he's pleasing her as much as the squirter. But it's really down to porn. That's what Grace Alice was saying, and this expectation of women to squirt. But I would love you to give me your take on squirting. So
I kind of got bad news. If you haven't squirted before you've had babies and you're squirting afterwards, it's more likely that you're peeing a little bit.
Yeah.
And this is really common.
Yeah.
And because your urethra is right beside your clitoris, like it's just when you get stimulated and aroused, it's actually causing a little bit of wee to come out, and that's okay.
And even if you empty your bladder completely prior to sex, you can still have a little bit of a leak, can't you?
Well, if you fully empty your bladder and you know it's empty, because lots of women don't know if they've a prolapse, but even if it's empty, within a half an hour, you'll have 50 mils back again. So I always say your bladder is like a water cooler. It's always refilling. So, but usually you need half an hour. Like if you do a pee for a doctor and they say, oh, I messed it up, go and do another one, you usually have to wait another half an hour to get anything out again. But there'll always be something there. So even if there's just 10 mil there 20 minutes later, by the time you both came, there can be a tiny little bit of wee there. That's okay. And you don't have to tell your partner. Like I've had women into me that are like, God, I never used to squirt before, or I'm actually coming so much easier since my baby and it's a little bit wet. Sometimes I don't tell them because I don't want to ruin it for them.
Yeah,
I hope they're not listening to this though. But I'm like, why tell them? They think this is a better outcome.
Yeah,
so you know what I mean?
Off it anyway if there's a little bit of pee. Sure, it's like all bodily fluids anyway.
Exactly.
So, okay. So the squirting thing is sometimes just this phenomenon that actually doesn't exist.
I don't want to say it doesn't exist, but in the vast majority, it's actually a tiny bit of pee because they're so close together.
Yeah,
the clitoris is just above your urethra. So it's like when your clitoris spasms and orgasms, it relaxes the nerves and lets out a tiny bit of pee.
Lovely.
Oh, and you know, before we move on from postnatal, I just want to plug something, Laura.
Oh, go on. Go on. This is the time to plug.
Okay. So I've developed an app. So for postnatal mums.
Aren't you fab? Like this is what we need.
And me and my friend Emer have done it and we put all our own money into it. So it's actually cost us so much more. We were like, how much does it take to develop an app? $5,000. Right?
Does it not cost $5,000? No. It costs much more.
In the decades or whatever, you're 30 to 50, right? So we've invested all our own money. But what we wanted was a guide for women. So on my Instagram every day when I put up postnatal boxes, and again, I know there's loads of perimenopause ones out there, but there's not postnatal. So when I put up question boxes for women, like, what are you going through? Like, it's all the same questions, but women just think it's only them. So me and Emer were like, right, we need to do something about this. So we've developed like an app for every woman who's had a baby, C-section or vaginal delivery, and it goes for 12 weeks after they've had their baby. And the first few weeks, we actually have different people on, like obstetricians and lactation consultants and psychologists talking about birth trauma. And I'm going to talk about things like hating your husband, but also the return to exercise, because so many women are returning to exercise too soon. And there is published guidelines to say you should not run till 12 weeks postpartum. You should not be lifting weights. You should not be doing any high impact, because that fascia we talked about, like the uterus has not come back up till 12 weeks. So women going out running at 2 and 3 weeks postpartum can actually do themselves real damage. And I mean real damage. And it's not their pelvic floor. It is prolapse. It is their bladder dropping, you know? So they don't realise this, and they're going for their 6-week check and they're like, oh, by the way, can I go back to exercise? Oh, yeah, if you're feeling it. No. And same with C-sections, 12 weeks minimum.
Mind yourself, girls.
Yeah. So the information's not out there. So I feel like, how can we blame
women?
women?
There's a 6 weeks thing. There's the whole 6 weeks thing.
The 6 weeks thing is we're not allowed to do internal assessments till 6 weeks. That's where the healing internally from stitches should have happened. So we want to give it time to heal before a GP checks them, or a physio checks them internally, because we don't want to cause an infection. Okay. So women only get a 6-week checkup and that's it. If their stitches have opened day 2 or 3 or 4, they can't restitch them anyway. So if they're afraid their stitches have opened, they'll need antibiotics, but there's no restitching. And women get really frustrated by that. But again, they don't know. So like on the app, we have an obstetrician talking about that. Like, if your stitches have opened, this is what you need to do. Like, talk to your public health nurse or go into your GP. Lots of women say, oh, they wouldn't look at my stitches, but like, if they've opened, they need an antibiotic. It's really hard not to get an infection down there, because there's poo, there's wee, there's blood coming out after you've had your baby, you're wiping. So we'll tell women, like, use hot water, get in the shower, but like, it's hard to even wash yourself in the postpartum period, isn't it, than get in the shower 5 times a day. I wonder
how women years ago, like when there wasn't obstetrics and there wasn't all this, how did women years ago like live, you know, postpartum, in terms of like with infections down there, certainly if they tore and stuff like that, must have been just awful. Yeah. Well, I suppose there was a mortality rate, wasn't there, for newborns? But
then look, people will argue there was less induction, there was less, we won't go down that route. But yeah, look, those women, even my mother's generation, still don't talk about their vaginas, Laura. Like, they, when they come into me in clinic, women in their 70s, they're just mortified. They apologise to me. I'm like, this is my job and I love it. And I don't mean I love vaginas. I love making a difference. Like, I love being the person to tell you things you needed to know and to make it more normal.
And it's so important, because I have had a number of women in the pharmacy as well. I remember this lady in, and she had, a lump down there, and she said, I don't want to go to my doctor because my doctor doesn't want to see my 70-year-old vagina. I'm like, your doctor does. That is exactly what your doctor wants to see. Yeah. And it's actually so important to get that message out there to our older, lovely, beautiful mums and grandmums and things like that, and to let them know that if they do have issues, they need to go and get them seen to, and that's what the doctors are there for. And
I think in Ireland, as well as not having people realising women's health physios exist, we don't have gynaes in primary care compared to other countries. Like, we should all be having our 1-year gynae checks, I think, and our smears should be done by our gynaes, because they might need to use small little speculums for women with issues down there,
Can nurses not do that?
They can, but I think, look, they don't always have all these small speculums in there. I don't even like the KY jelly that they use, is actually full of chemicals, and I tell all my women to bring your organic lubricants with you. Like, our vagina flora is so sensitive, and then when women have like low vaginal estrogen, they're dry, they're sore, they don't want to go for their smear tests, but no one's telling them why, because no one's talking about their vagina, Yeah. If they were going to a gynae every year, I think the gynae on a yearly basis could be telling them what to expect as they're going through the different stages in their life. And okay, I've had my baby last year, and is this normal? And my prolapse, and I'm in getting my smear. I just think an annual gynae check is what people do in other countries, but we don't have gynaes in primary care. just do that. You know,
Okay.
they're like the GP of your vagina, you know?
Okay.
And maybe if they did, women could ask more questions and be way more aware of what's going on with their vaginal health. You know?
And is this what prompted you to do this app then, in terms of the postnatal females and...
Well, because they get one appointment and everyone's saying, oh, they didn't do this, they just asked me about contraception. I always defend the GP because I'm like, by the time you change the baby in that appointment and then weigh the baby, measure the baby starts crying, the baby needs a feed, the appointment's over and the mum gets very little. But then that continuous change over the weeks and months, like our hormones, Laura, hair falling out, like this roller coaster of just drops in estrogen, having no libido, you know, women getting, like some women come in to me think they're leaking and it's just vaginal discharge, but loads of it. There's all these bodily changes like, oh, my hemorrhoids haven't gone away. Will my you know, the skin tags that have formed on my body or my stretch marks. So all this stuff that's happening in pregnancy, they're expecting the bounce back. The bounce back doesn't happen 90% of women.
Yeah.
And then they have all these questions about what's going on in their body. And maybe in that first 6 weeks, Laura, they're still in that fog of like, I haven't slept, the baby. It's like even during childbirth, women get forceps. I mean, I take a C-section over forceps any day. But when you're in the height of labour, you're just like, get the baby out. You know, you have that maternal instinct. Get the baby out no matter what you have to do. Like, just save the baby. And I think even by the 6 week check, women are still like, baby. And then after a while, they're like, what's going on in my body? And they're so, like, we were even talking the other day on my Instagram about shoes not fitting them and their rings never going back on, you know, and people go up 2 sizes in their feet, like things that aren't even connected to their vagina, you know, their boobs and like just sagging afterwards and not lifting back up again. So, or women who have things like IBS or Crohn's disease, they can be really not symptomatic during pregnancy and while they're breastfeeding and then boom, it comes back with a bang. So hormones, like we're talking about it so much in menopause now and perimenopause, I still feel like that postnatal woman is still not talked about. Even if it's only for a year, and even though we say postnatal forever, lots of women have 2, 3, 4 babies. So for 3 and 4 years of their life, they're just like, what the fuck?
They're in a fog of postnatal. No, you're right. It's like the pregnant woman is minded and the baby is minded, but the post-pregnant woman isn't really minded that much, and she needs to mind herself.
Yeah. And
what's your app called?
It's called Moco Health.
Moco Health.
Moco is for mother covered.
Okay.
Yeah. We didn't want to put mom, mummy, mammy, and it's going to be all about the mum and not about the baby. So every day, we know mums don't have time for anything, to read, to watch. So every day we've just one little short video to give them a take-home message for the day.
And how much is your app?
A tenner.
Oh, that's very
good,
reasonable. That's very reasonable.
And then just to say, we do, of course, pelvic floor exercises. And then me and Emer will do not fitness, but just rehab. Like we'll say, like you get a knee operation, you get a back operation, you're sent to the physio, you do weeks of rehab. You have a baby, nothing. There's no guidance.
And when you think of the trauma that your vagina's gone through to push that baby out and the rest of your body.
Yeah, your tummy, Laura, you've no strength, your back's killing you, your shoulder. But pregnancy is 9 months. We're like, it's a marathon. Then you have the baby and your body just falls apart. But there's no guidance. Oh yeah, you can go back to exercise. Whereas you have a little knee, like a meniscal injury, and they're like into physio for 6 weeks. Doesn't make sense. Like it doesn't make sense at all. So like you need to be guided by someone who knows what they're doing. So we call it rehab. We don't call it fitness. And when they're finished doing our rehab, we're like, now go back to your fitness. Now go back to your postnatal classes and stuff. But just like at 6 weeks to 12 weeks, and we did it in a way, like last thing to say, we've just done a few minutes every day, 10 to 15 minutes. There's no point doing one thing 1 hour a week. It doesn't make you strong. But mums don't have time to do an hour class. Like they just don't have time to look after themselves. So if you make it achievable, we're like, right, get dad on board or your partner, go up to your room for 15 minutes a day. Like ask for 15 minutes a day to lie on a mat and do your exercises and set yourself up for your recovery. And just to, be guided by the right people.
Can pelvic floor exercises, are they easy to do or do you have to be taught by a physio to do them?
Like really you need to go, and like this app will not replace people going to Women's Health Physio. Look, maybe if they can't access it or afford it, it's way beyond just the pelvic floor exercise, the app. But like really everyone should like treat themselves to one appointment with us because it's way more complicated than they think. Most women that come into a store are doing them wrong. Like some women, when they squeeze, they're actually bearing down. So if they have a prolapse, they're pushing the prolapse out. Like I'll get them to put their hand there and go, feel your prolapse every time you squeeze. So they're actually making their prolapse worse.
You're making me clench even sitting here, do you know that?
And then we always talk about like some women are good at squeezing, but they don't let go. So I'll say like if you're doing bicep curls, you don't just go squeeze, 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 and then go, oh my God, my muscle is killing me. You have to let go. But when you're watching someone do something, you're like, oh yeah. And that's how your brain works. Oh, I can see you doing that. Okay, I'm just going to copy you. Even when we do virtual physio appointments during COVID, we'd be like, no, lift your arm forward. Even when people are watching you, they do the complete opposite thing.
Okay.
So when it comes to our pelvic floor, we need to put our fingers in. Like we need to get them to squeeze, and we need to get them to teach them how to let go properly. And that's really important for pooping and emptying their bladder, that they can relax their pelvic floor. When they're doing their squeezes, we need to make sure they squeeze all the way up to the urethra. I'm always like, get up to the penthouse and get down to the basement. Don't be stuck on the middle floors. Like get right up there. So different cues work. I've talked to you about before about sucking spaghetti up your vagina.
Oh, do that one, will you? Go on. I love that. I love it. Go on, do it again.
I forgot my spaghetti.
Oh, damn it. Well, discuss it.
So look, one of the cues I would use, especially for women who aren't getting up to the penthouse, so up to their bladder, would be take a breath in through your nose. Now imagine you're sucking spaghetti up your vagina, right up to your belly button, and breathe out slowly. Keep sucking the spaghetti. Breathe out through your mouth. Breathe out through your mouth. Keep sucking your spaghetti. Don't let it go. And now as you breathe in through your nose, open your vagina, open your back passage, and let the spaghetti just fall out in the plate. So it's a real upward sucking action, but then what people don't do is let go again after. But when we assess someone, Laura, they could be really good on one side and really weak on the other, you know, or like that, they're not getting up to the top, or they're not able to relax it down. So even one appointment, women are like, oh my God, I've been doing them wrong. I've been doing them wrong all the time. And they're buying all these gadgets off the internet, and it's not really telling them if they're doing it right. And I love the gadgets if it means someone is like, oh, this makes it more fun. It attaches to my phone.
Are you talking about something that they put up into the vagina to help them?
Yeah, the pelvic floor trainers. So they're
Okay.
usually little probes. You stick it in, and when you squeeze it, like there's different ones out there, but some of the good ones are it goes to an app on your phone and you can kill the birds. And when you squeeze up, it goes up, and then you have to drop it. But it doesn't actually tell women if they're relaxing again. So they're like, I can't get the bird. I can't get the bird. I even heard, I'm gonna talk about another podcast for a sec, Laura.
Okay.
Do you ever listen to Vogue Williams' podcast?
Oh, I do, yeah.
So she was talking to Joanne McNally, right? And Vogue has actually done a lot for women's health. I give it to her, the mummy MOT stuff. I give it to her because she has a totally different platform. All the mums are like, what the hell is this? So she has made women book in for these appointments by listening to her. But she was talking to Joanne McNally on a podcast, and I wish I could get the message to them in case they listen to you, Laura. So Joanne went with Vogue to one of her appointments where they sat on this chair, right? This pelvic trainer chair. It wasn't the MSALA, it was something totally different.
Okay.
And the physio was telling Joanne, oh, you've a really weak pelvic floor, Joanne.
Oh, I think I remember this. Yeah, go on.
When you squeeze, nothing's happening, right? So
Okay.
she said to her, your pelvic floor is shit. Are you sure you haven't had babies or what's going on? And then Joanne was saying to Vogue on the podcast, it's so weird because when I go to my gynae, she says my pelvic floor is so tense. And I was like, this is exactly the problem. So when she's sitting on that chair and she does a squeeze, because she never relaxes, it doesn't go squeeze, squeeze, squeeze. Because her pelvic floor is so tight, when she squeezes, nothing changes. So when she sits on the chair, they're telling her like, oh, your pelvic floor is really weak. She's the opposite problem. They're so tight, they won't let go.
Okay.
So I was like, how can we get this message to Joanne? Don't go on the chair. This is not for you. She needs to learn how to let go of her pelvic floor and actually, like the bicep, squeeze and let go. But it's like she's squeezing, so the chair isn't registering any change. So that's why with technology, that's the kind of fault in it. You know, it's not physically going, I can't feel you letting go. So then people are using the gadgets and coming into me, and I'm like, your problem is you're not letting go. And then the little gadget's telling you you're not squeezing.
Okay.
Does that make sense?
Yeah, no, it does.
I hope it does.
So how how rare are women's health physios then? Because if someone takes years to get to you or find you, you know, you're only one person. I know you've recently hired, or you're going to recently hire someone, maybe, I'm not sure. But like, so how many women's health physios are there in the country? Like, are they easy to access? Do they need to be referred by their GP?
No.
Can women just ring them up?
Yeah, so you don't need a referral at all. You never need a referral for any physio, but you don't need a referral for us. I would say across the country, Laura, there's at least one per county. But it's actually hard to get training in we become physios. So for me, I became a physio was a physio for years and years and years, did my master's in musculoskeletal. There is a master's for women's health, but the really good one's in Australia. So a few physios would have lived in Australia for a few years and decided to do the master's while they were there. And there's one in the UK. It doesn't have a great name, but anyway. So for us to do our training, we have to travel a lot overseas. We have to work with overseas experts. So we really have to like push ourselves, like the amount of money I spent on my training. And I do a lot with Australia. So I'll have to stay up on Zoom calls till 3 a.m. just to do courses like 3 nights in a row. Like Mother's Day, I was doing it. And my birthday, they always fall on, my husband's always really annoyed at me. He's like, it's always these days. I'm like, but it's a brilliant course. So we're so invested that we, have to really push ourselves to get our training. So there's not that many of us, unfortunately. And not every physio likes vaginas or wants to go into that. It's like doctors, not all of them go into gynecology. Like it has to be an interest. I think when I had my first baby, it made me even more interested. I think it's normal when you have personal experience of something and realise there's such a gap out there for women.
And how much is an appointment then?
An appointment with me, we all vary. I'm Dublin, so we cost more. I'm 140 for an hour.
Okay.
Like if you think about it, you pay a consultant $250 for 15 minutes usually when you're going private for anything. And generally physios cost about $65 for half an hour. So I'm kind of not that expensive. You can claim back on your health insurance. But yeah, there's usually one of us per county. You can find a list on the ISCP website. That's the Physio Association website, or Irish Society of Chartered Physios website. But we are in the maternity hospitals too. You can get a referral. So if you need to go publicly and you can't afford to come in, it's just like everything in the public sector. You have to be prepared to wait.
And then obviously they see the really bad cases first.
Yeah, so it would be your 3rd or 4th degree tears after women have babies that are fecally incontinent, and that happens. Women, about 4% of women are fecally incontinent after they have babies. So they'll be prioritised as they should. And then they're also seeing women who've had gynae surgeries. So they're not, maternity hospitals also do a lot of gynae surgeries. So they are seen a lot. But you can get referred, just be prepared to wait. There are some in primary care centres, but very few. So privately, just Google women's health physio in my area and you will find us.
Okay. And it's not just about going and learning your pelvic floor exercises. There's so much more to it than that.
And like with pessaries is a big thing for me now, Laura, like even with leakage and even overactive bladder, which you've covered before, pessaries can be brilliant for that. So I think we're quicker to access. Like you don't have to wait months to see us. You might have to wait 2 or 3 or 4 weeks, but like we can do a lot. And you know what? Because it doesn't involve surgery and it doesn't involve gadgets, we don't promote ourselves. Like we don't have the same funding, to promote ourselves. And even GPs don't often know about it. So women will be sent straight to gynae. I think we should always be the first port of call because we could help 60-70% of women that don't need invasive treatments or even delay those treatments. So I think if they come to us first, conservative management's always the first, and all the guidelines say we're first port of call. But some GPs don't even know we exist, so they just send people straight to gynae. And I always say when you see a surgeon, expect surgery, because that's what they do,
Yeah, okay. And then in terms of the pessaries, they're obviously not a one size fits all, but you get them specially made for a particular size vagina, or do they all come in, is it that they come in like, 1 centimetre, 2 centimetre?
They come in sizes, so we have to fit people. Now you can buy some on like the internet. There's some you can buy on the internet for incontinence, and I think they're brilliant. But even with them, they come with a little sizing kit to pick the size you need, because it depends on the size of your vagina, and that's the truth of it. You were talking before about tampons not being the right size. Exactly the same. There is actually evidence to show that when women use a pessary, it can help close the size of their vagina. So instead of people thinking it's pushing it open, actually if you lift everything up and support it, you can help the tissues and the muscle close in a little bit.
Though, doesn't it?
Yeah. Like in Australia, they're trying like prophylactic, like women have babies, give them all a pessary. Like hold everything up while they heal. I think that makes so much sense,
It absolutely does.
We also do things, just to say, called electrical stimulation. So I know the Emsella chair is similar, but we would put it in people's back passage who have fecal incontinence, and even for overactive bladder, instead of them getting Botox injections, there's just as good of evidence of using TENS machines, the normal TENS machines for back pain. You put them on someone's foot. It doesn't even have to go in their vagina. The tibial nerve stimulates the bladder. 2 sessions a week for half an hour, put a TENS machine on their foot, and it'll give them nearly the same results as Botox.
Wow.
With way less. So they could buy a TENS machine or rent one, use it 2 sessions a week for half an hour. But that isn't talked about because it's a really cheap conservative method that's really not complicated. Now, not every woman, but it should be the first thing that's tried.
And is that why reflexology works well in terms, you know, you don't know?
I don't know because I don't know the science of reflexology.
Okay.
I know you talked to someone about acupuncture. I was listening to it. When there's not a physiological explanation, that's what science is about. So I believe in things that help people, but when you can't scientifically explain it, it's hard to then not back it, but like everything I do as a scientist is like, why would this work? At least using the logic if the science isn't there. Okay. So it's like with the pessaries. Doesn't it make sense if you lift the uterus up, it's not pulling on the strings so much. It gives the chance the strings to shorten again and tighten up again. That makes sense, you know, in the world of physics. So with TENS machines, what it does is it stimulates the same nerve that annoys the bladder and helps that nerve to calm down.
Okay.
And that makes, and there's actually really good evidence for that though, like really good evidence.
Yeah, that's so interesting. I hadn't heard that.
And it's why with bladder urgency, people, you know, that key in the door, like it's all about that flight or fight response. And that's not because it's in your head. Like when someone's key goes in the door and they're like, oh my God, I need a wee and I need a wee now. Their nerve affects their pelvic nerve. It stimulates their bladder and their bladder goes into a spasm and just wants to push out the wee. So we have to counteract that by either calming down the nerve psychologically. So we do this thing called bladder training and it really works. And we get women to breathe and we say, count back from 107s, something that's really hard. I always say
so they have to think of something really awkward.
Really awkward. Like I always say, if you were walking down the road, Laura, and you were bursting to go to the loo and someone crashed in front of you, you would forget because you'd be like, oh my God, look what just happened. So when your brain is completely distracted, those nerve pathways get distracted. And that's how women can kind of calm their bladder down. Rather than it being in their brain, it's not. And estrogen is a big trigger for that too. So the postpartum woman or the menopausal woman, when their estrogen levels are low in their bladder, I always say like there's these guards on the gate like Buckingham Palace and it's like they've stepped away. So when estrogen goes low, the guards step away and they let all these nerve synapses into the bladder and the bladder gets really spasming. Okay. So vaginal estrogen is brilliant for overactive bladder and bladder training is brilliant for overactive bladder and TENS machine is brilliant for overactive bladder and none of those things involve a visit to a doctor or really expensive treatments.
So I really only in the pharmacy see vaginal estrogen prescribed in menopausal women or postmenopausal women. So really if someone has overactive bladder, there's very much a place for it and it should be talked about and given out more,
But what you'll see, Laura, is it becomes more prevalent in the perimenopausal menopause. So it will be 40s, 50s, 60s, you know, just will. Look, I did my thesis on tendon pain about 12 years ago. And even at that time, we were like, the tendons like tennis elbow, all these tendon issues come in between 40s and 50s and we don't know why. Query, you know, dehydration, query changes in the tendon fibres, but we don't know why. Now only 10 years later we know it's estrogen. Like estrogen is everything.
I know.
It is
just
everything.
All over our
and
bodies.
Because we're estrogen dominant, it fucking wrecks everything.
Yeah.
You know? I'm going to be banging on the door for estrogen as soon as I feel I need it. But vaginal estrogen should be over the counter. There is very little side effect to it or risk attached to it. So Viagra's over the counter, vaginal estrogen isn't.
Yeah, well, maybe in about 10 years in Ireland, you know, like we normally are a little bit behind. I'm saying that very sarcastically, actually. The UK, they have it now.
Yeah.
Vaginal estrogen OTC. So
unfortunately, even with a physio, if I see an overactive bladder, I can't prescribe her estrogen and then I send her to her doctor. And in most cases, the doctors will give it, but in some cases they won't. And I have no reason why, you know. So sometimes I have to send her to another doctor to get it.
Don't go to that doctor again. And are there any other points you want people to know about their vaginas that just isn't something that is talked about enough?
Look, the last thing is like if we're going through the ages of your vagina. So like you're young, you know, you're scared of it, it hurts during sex, it won't relax. And then you have your babies and your vagina is completely changed and that freaks you out too. And you still don't want to look at it or find out how it's changed. And then you get to be perimenopausal or menopausal. And we have a thing called vaginal atrophy. So the lining of our vagina really changes and thins out. So just while we're on the topic, women in their 40s, 50s, 60s who are experiencing really uncomfortable sex need to get vaginal estrogen and stay on it for life. It's good for your bladder. It's good for your vagina. Stay on it for the rest of your life, just twice a week. But know that it is normal for your vagina to get dry. And it is normal. Some women get real burning, stinging pains. And like, basically, you know, our vagina is amazing, but through all these different stages, it just turns on us, you know?
It's poorly designed in that sense. But I suppose the reason why it dries up. Like, it's such a horrible word as well, atrophy and drying and all the rest. You know, it's just not nice. But, you know, so if you are experiencing that, know that there is help. You can get vaginal estrogen. And even if you've had estrogen positive breast cancer, you can use the vaginal estrogen, because I think over a year of using vaginal estrogen, it's like taking one HRT tablet. That's how little gets into the system.
Yeah.
So it's really a really easy fix for women who are experiencing issues like that. And interestingly enough, like the whole reduction in estrogen and that also affects women with like UTI infections and things like that. So it has an entire, like, it all overlaps. And the vagina is so near the urethra that even if you are getting the vaginal estrogen, it's helping with the urethra. It's reducing those symptoms that you might be experiencing where you're feeling that you have a UTI, when in actual fact it's just genitourinary syndrome of the menopause. It's just like a tingling, funny sensation down there where you don't where you feel like as if you have a UTI, but you don't.
Yeah.
And, you know, years ago, women were going to their doctors, you know, regularly with thinking they'd UTIs. The UTI, the doctor would do a test, it would be clear, and they'd be sent on their way saying, I don't know what it is, all in your head. When it wasn't in their head, it was just a lack of estrogen.
No. And that's that urgency symptom too, Laura, because UTI is kind of like that, where you feel like you keep needing the loo now. So even with saying that, what the vaginal estrogen does is increase the blood, like it plumps up your blood vessels. So in the urethra, it can make the pipe smaller. So that can reduce leakage. It plumps up your vaginal tissues. So then that makes sex feel more comfortable, and also perhaps sensation if there's more blood flow. But then it also gets into the bladder and helps those urgency symptoms. So it's so good for all these pelvic health symptoms, including prolapse. Doesn't reverse it, but some women will feel their prolapse more because their estrogen is less. That's why everyone thinks prolapse is old woman thing. You have a prolapse after you have a baby, then your estrogen goes low and the collagen goes low, and down comes the prolapse. So actually giving some estrogen to the area does nothing but help it. So me and my friends joked, you know, other than the app, like as women's health physios now, we have our own conversations, but we were like, I'd love to be a hamper.
I'd love to be a fly on the wall of your WhatsApp groups. Will you let me in for even 24 hours?
No. GDPR. But look, we always joke like, oh, if I could make a hamper on Amazon for like someone's 45th birthday, it would just be full of vaginal estrogen and vibrators and, you know, what women need at that age. And
why do women need vibrators at that age?
For clitoral stimulation, because they can't feel much happening in their vagina.
Oh, okay, fine.
You know, even like, you know, sex toys and things, like, you know, you've talked about all that, but it's just coming outside the entrance of my vagina has changed. That doesn't mean it's the end of your sex life. Like, our vaginas were, I suppose, they're there for just to give birth. I don't really want to say that. Like, it is the birth canal. So when the birth canal gets damaged, we have to improvise, don't we? And still
100%.
enjoy it.
Yeah, well, I mean, if you want to have an enjoyable sex life as well, it's important to.
And like, even though everyone's scared of all these things happening, it's happening to everyone. So if you sit at a table with your friends, and again, there's like this joke of, oh, I leak on the trampoline, but no one's going, what size is your vagina? And like, can you feel your husband's dick going in? And like, do you have a prolapse? You know, like, maybe if you're listening to stuff like this, we're going to talk about it more. Everyone's going through the same things. Everyone.
Exactly. Like, there should be a vagina show and tell, I think.
Yeah.
100%.
We'll take
you and your
to the
girlfriends. You and your girlfriends take a picture of your vulva and see if you can like pick.
I have assessed 3 of my friends, but a few of them won't come to me. And then I honestly say to my patients who are really shy, I'm like, if I had a lineup of vaginas, I wouldn't put the vagina to the face. You know,
you wouldn't match the face to the vagina.
No. And lots of people live locally to me. I'm like, look, if we're open Harry's for pints, I'm not going to remember whose vagina you were. It's not how I look at it. If they leak on me, like, often I'll be trying to get them to leak. I'm trying to see where it's coming from. They're mortified. I'm like, you're probably going to leak here. I'm making you leak, you know? So people are mortified, but in healthcare, that's not how we look at things. No. We're trying to get to the bottom of a problem. And if I hated vaginas, I wouldn't be doing it, you know?
And actually, just like a little bit on yourself, how did you get into all this?
So yeah, I'm a physio, and then women's health physio is a thing. I did a couple of courses. I just started to get a bit interested in it, and then I had a baby. So before this whole women's health thing took off on social media, I had my own baby, and I was like, oh my God, like, I think I know, but when I go through it, I don't know half of it. I was women need to know this. Then I was setting up my own clinic, and I was doing only women's health, and I was a bit nervous. I was getting rid of all the back pain, neck pains. I was like, it's going to be women's health, but I'm a bit nervous it won't be as successful as my already older clinic in town. And then I met a marketing person. She's like, look, you have to go on Instagram. It's a great way to promote yourself. So I did it and I love it. Like I actually, like if I had time, I'd just quit my job and do Instagram, but I just don't have time. I just love it.
Aoife and I were chatting last week and she goes, Laura, I have like a really good reel where I want to go into a vagina, like on the reel, but I'm just trying to figure out how I can do that. I'm like, well, okay, good luck to you. She goes, don't steal my idea. I said, don't worry. That idea I'll leave to you. I won't steal that.
I lie in bed and just think of things.
So
I
it's
just don't have time.
only a woman's health physio would think about how can I actually do a reel where I'm inside someone's vagina pointing out the bits. So did you do that reel yet?
No.
Okay, I'm dying for it.
I hope I get it out before you do this, so the women's health physio's not thinking and steals it. But
there's enough room for you all.
There is. There's
enough room for enough reels with enough women's physios up vaginas pointing out the bits.
Yeah, there is.
And is there anything that we should be looking out for as when you were talking about vulval cancers and things like that? Is there anything like that we need to be looking out, like the breast check? You know, we're all taught to chest our breasts, to check our breasts. We're not really taught to check our vaginas, except we're told that look, if we bleed, you know, when we shouldn't bleed during sex, if sex is painful, we need to go and get seen to, etc. when it hasn't been painful before. So is there anything we should be looking out for?
Well, like I said, using the mirror to check for external changes like lumps and bumps and different colours. Don't forget to have your smears while everyone's on here. Like, please keep on top of your smear checks. And like discharge changes, like be aware of your discharge and what's normal, like your thrush, your bacterial vaginosis. It's common.
Is the fishy smell normal? Because, you know, a lot of people would say they've gone for they have a fishy smell down there. They've had all the tests. It's all come back clear.
Like everyone's vagina smells. You know, when you go into someone's house and you kind of, like my uncle, he was rich and he just had this smell of richness when you walked into his house. Like it just smelled like wealth. I was like, this is my goal. Anyway, I didn't succeed because physios do not get paid a lot. So look, everyone has an odour and it can depend on your sweat glands and it can depend on, you know, a lot of us don't like hair anymore and that affects our odour because hair is what keeps out all the bacteria. Sometimes you get swabs and they're negative and sometimes the infection is higher up. So you can't rule that out. If you have pain and lots of discharge, but the swab is like, you can have an infection up in the endometrium, you know, and they're way harder to diagnose. But like a smell is normal, you know, it is. And while we're on the topic, don't wash your vaginas with soap. Just don't do it.
And what about, I'd say you're a real fan of douching, are you?
No, wash your vagina with anything. We say do you wash your food pipe? It's the same thing, right? It is self-cleaning and it has a very sensitive pH. It really does. It's why it hates lubricants and it hates condoms and it hates latex. So leave it alone, right? Let it clean itself. Don't put anything up there, even those femme products that are like pH happy or what, I don't know. Just leave it alone. Let it find its own pH. If its pH is off, it's because you're off. It's because your gut is off. It's because your bowels are off. It's because you're not healthy in your life. So squeezing stuff up there usually doesn't help.
Okay. And then the vulva, it can be washed with a little bit of soap, can't it?
Yeah, I don't even go near it. No, I don't even go near, like I just use warm water down there. Because when you say vulva, you're talking with the external flaps, right? The vulva includes the whole external area. So looking at it, your perineum, your urethra, that's all your vulva. So don't put soap between your flaps, the big flaps. Don't put soap in there.
Okay.
It's not even just up the vagina. It's that whole, it's all mucosal. You know, so just leave it all alone. So if you want to wash outside your flaps in your groin creases, but not actually in between.
And your bum, it's okay to wash your bum hole with soap.
Wash your bum hole.
But like leave the vaginal vulva area alone because it's beautiful and self-cleaning and it doesn't need anything.
Start looking at it and talking to it and give it a name.
What do you call yours?
I don't know.
Do you not? Do I tell you what I call mine? My muffin. We've called that for years, like since I was a little girl.
Yeah.
Like it's always. But
I did a question box on that. I used to call mine my front bum when we were younger.
I don't like that.
Do you not like
that? No, because it's not your front bum. It's completely different. And a bum isn't as nice as a muffin.
No, I suppose there's a crack.
A crack.
But then all the South Side women call it me Mary. All the ones from round Crumlin. I got loads of these on. Me Mary. I don't know where it came from.
My Margaret.
Virgin Mary.
My Betsy. I like that one. Betsy's lovely.
Yeah.
My Mary Jane. You know, but the muffin. But like, I just think, and it's nice to have a little pet name, but it's nice to love it. And like, don't have a depressed vagina. Love it. Learn to love it. Get your mirror, look at it, feel around it, feel inside you. You know what's normal. and accept it for what it is.
Yeah, and accept all the changes, the poor changes, which are happening everywhere in your body, you know?
Exactly. And talk about it with your girlfriends. And you'd be surprised, actually. I'd say once you open up the conversation, people won't stop.
Yeah.
They might look at you a bit weird initially, but you know.
Or pick them. My mum always says there's certain friends for certain reasons, you know? So ones that are good crack, ones that if you're having an emotional time. So pick the ones that are willing to be open. Some of them will run out of the room.
Pick the vagina, vulva. Pick the vagina, vulva.
I have a real male sense of humour when it comes to sex and stuff, you know. Even my husband's like, oh God. So you know, just make sure you're talking to friends who are kind of open, who aren't just going to sit there and judge you.
Yeah, I know. Sometimes I send into my WhatsApp group my girlfriends, and like sometimes I'll send something really just like innocuous, just normal, and they said, Jesus, I actually expected when I click into that to see a big black willy or something. You know, like, so they know if it's going to be filth, it's going to be coming from me. So Aoife, I always ask 2 questions of every podcast guest, and you have been warned, so I hope you come up with something Einstein-y in answer. I'm only messing. No, there's no pressure. What bit of advice would you give young people today, and what is the meaning of life?
So the young people, and I know they won't listen to it, is to get rid of the phones. I'm dreading when my kids grow up a bit more, and like I love social media. I've just talked to you how much I love Instagram. But I'm so afraid for them to go on social media. I just went out and played, like even when I was my little boys age 4 and 5, I was just out playing and learning bad things, right? Getting streetwise, like kissing boys at too young an age. And, you know, like
learning about your vagina.
Yeah, coming in getting kicked in the vagina and coming in way too late and stuff. But like, it was all innocence, and it was like, you know, building your personality and like learning to kind of fight your corner. And I used to love playing with the lads, and I used to be a tomboy till I became a teenager, and then I just fancied boys. But like, I say my mum thought I wanted to be a boy, and she's like, oh no, she doesn't.
No, definitely not.
You know, and drinking when you're a teenager in the park, and I don't know, I just think like that could be our youth, but I just think now with bullying and stuff, like not just that they're on their phones so much, I'm just so worried about what's going on the internet. And like even when I'm on Instagram, you can't help but be influenced. But like imagine when you're 10 and 12, like I didn't have smartphones when I was that age. My kids are so young. My husband's like, they're not getting a phone till they're 18. I was like, good luck with that. I'm afraid not of computer games and not of screen time, of what goes on their phones and how to monitor it. And I'd actually just love them being out, getting up to no good on the road.
Yeah.
And coming in kind of drunk when they're 14 or 15. I'd rather catch them in drunk than them just sitting in the room all day on their own, you know?
Fair. No, I know. I get you. Definitely. There's way too much of the phone use. And then meaning of life.
Meaning of life, I thought about this. You could say a million things. I think the meaning of life for me, right? And I'm a mum, and like, I'm not going to go in. I love my family, right? But I'm more than my family, and I'm more than a mum. And my other family, like, they're grand, but they wreck my head sometimes. But I think it's about trying to make a difference, right? So I was thinking, like, I became a physio when I was 18. I always want to be a physio. The points are really high, but the money's really bad. So like, if you can become physio, you could be a doctor, you could be a dentist, you could be a pharmacist, and you're all loaded. Whereas we actually are capped at very low wages. So you don't do it for the money. Like, you honestly do it because you want to help people. And like, that is the truth. And as physios, I think we're always really good communicators. You know the way we sometimes talk about doctors not having the best bedside manner? Like, we're really good communicators, and we really want to help people in their quality of life. So that's why I chose to be one. And that's honestly the truth, because the money isn't good. And now I'm in women's health, and now I'm on Instagram. I'm like, I actually just want to get a message out to more people, more than just the ones in my clinic. So every time people are like, God, I didn't know that, thanks so much. I'm like, I'm making a difference. You know, like when I leave the world, I've made a difference. So, and I'm having fun doing it. And I think that's important, you know, instead of going, you know, oh yeah, I told these people this. I'm having fun doing it, and I'm delivering it in a way that people can relate to it. So I can use my personality, and I think it's so much good fun, but I'm making a good impact on people's lives, a bit like you, Laura.
Great. Well, that's lovely.
That's my meaning of life.
That's your meaning of life. Yeah. Aoife, you've been an absolute pleasure. We'll have to get you back on again, because I'm sure the conversation we've just had will just like cause more conversations about it, and then more questions as well. Thanks a million.
Thanks, Laura.